Hey everyone, welcome to the weekly original CrockPet Diet Q&A. I am your host, Michael Daly, certified holistic pet health coach through Dr. Roberts, certified canine massage therapist, certified equine shiatsu massage practitioner, vet tech, and pet owner for a long time. So, not that many questions this week, so I guess that's good. Hope everybody had a good week. If there's not that many questions, let's talk about like TV or movies because that's my main thing. So, have y'all seen Mandalorian? Are we liking it? I haven't watched it yet. I'm not seeing too many posts about it. So, yeah. I'm kidding. We're gonna get to the crock pot. Sorry. All right, let's get on here. All righty. Okie dokie. I guess not too many questions. I don't think I have to go. So, let me do Laura's last. Let's see. So, um, Denise was asking, I was hoping to get back to the original. Oh, I actually answered that last time. Geez, there aren't that many questions this week. And I think Han is getting that for you. And then Patty had wanted one too, and I sent a copy of the updated one. Beverly asked, I am cooking chicken breast, no boners. I'm cooking chicken. Oh, wow. Okay, Mike, let's wake up. Voice and speech. I am cooking chicken breast, no bone or skin. Is there a recipe for this, or should I just use the template? Is amount of calcium to meat a constant, or does it change based on the type of meat? And so let's go ahead and pull up the template. And you're fine. You can actually let's go ahead and read the comments first. So May, I would use the template and never change the amount of calcium based on the protein. Really, you only changed it based on the beans, whether or not you're using beans in there. And I'm actually going to tell y'all. And then Lolly answered, the amount of calcium in 3 pounds of chicken breast and turkey breast are basically the same. Turkey has 192. Yeah, and Lolly is exactly right. She says turkey has 192, chicken breasts have 205. I've been cooking chicken breast for years and always use the same amount as a turkey. Yeah, and that's the thing, guys. It's not when we're looking at the calcium, we're looking at the phosphorus, and the phosphorus isn't really that different. Pork has more phosphorus in it, so that's where it may change. But honestly, the difference isn't that much in between. So, but we've had a lot of questions on about the diet with the recipe and a little bit of confusion, consistent confusion with. Can y'all see this when I show it? With the recipe, with the table for the calcium. So I actually brought it up with Dr. Roberts. Well, one of the news pet health coach students brought it up, and I brought it up with her. And so we're going to fix this. The little table that's underneath that is causing some confusion. So we are in the midst of fixing that. I'm not sure when the new template's gonna be out, but just so you know, we're gonna fix it so it's less confusing. So that's good news today. Yay! So yeah, so just use the template, same calcium, you're good to go for the turkey. There. That's it. Yeah, not a lot of questions at all this week. So Laura's been having a lot of issues with her baby girl Lulu, and she had posted last week for I missed it, but her pet's Lulu's eyes, and I brought this up with Dr. Roberts, and we discussed, yeah, it could be just because you see the little concaving here. With Lulu, so that is a sign of some muscle loss. And so, the trick was we needed to see the other eye, which Laura did send pictures of, and equally that third eyelid is up for both eyes. So that kind of goes consistently with some aging changes and muscle loss there in the head. So basically, we said that there's no irritation or anything like that. The eyes should be okay. I think that Laura had said that there was some irritation when going outside. So I had recommended you can use saline to wash the eyes to outside allergens, or ask your vet what ointment or drop they would recommend. I have to be really careful, guys, because I'm not a veterinarian, so I can't give you veterinarian advice. So that's why I would say, let me ask Dr. Roberts, and Dr. Roberts says. So yes. And the other thing, and the other thing that Laura has been struggling a lot with is diarrhea, with trying to get off one food and over to the CrockPet diet. And we had recommended some RX clay, which can help really bind the stool and can help. But Lulu is still, baby girl, is having some diarrhea. So, and the thing to think about, I think, with older pets, because Lulu is 16, so I've been messaging Laura on Facebook about this. So just to keep in mind that she's an older lady, and if we've all had parents and how to take care of older parents, we know that you know they get to a certain age, and it's, I mean, how many trips to the doctors I had to take my parents on before they passed away was just, just never ended. It was like whack-a-mole. So that's the thing about too with older pets, that, yeah, the older they get, the more issues they're going to have, but that's okay. That's sort of what the deal is. It's a lot of whack-a-mole. So just don't. I don't think it's, don't feel like you need to panic about situations. And Laura's doing so great with Lulu. I mean, we're all reading the comments. And she had brought up this in her question, so she's negative for, they finally had the third fecal fluid for Giardia cysts, and that came up negative, which is great. That's a wonderful primary underlying issue to address. And then she started the new low-fat CrockPet starting Wednesday, had diarrhea Thursday night, including using the clay. So she was looking at another supplement called BM Tone Up Gold, which I was looking at. And basically it's a bunch of grape and fruit extracts that are supposed to help fight off infection and calm the intestinal tract. And what I would say, and I was messaging her this, is that as a pet health coach client, the first thing that I would probably do is do the Glacier Peaks allergy test, the food allergy test. Because I just, from my experience, the older pets we're looking at leaky gut syndrome. And, a lot of you on here know what, the idea behind leaky gut, but with leaky gut, you're basically looking at, and when I was going through this with Dr. Roberts in my training, it was, it's very scientific. So I just, basically, like, the idea is that this is basically the intestinal lining of the gut. And you're looking at a normal gut here. So there's these little in between areas that pathogens and other outside things can't get through, as opposed to the gut here, where it's leaky and damaged, where pathogens and things like that can go through. And so the older we get, the more the leaky gut tends to happen, the more the inflammation and the damage due from all sorts of things, stress, from stress to chemoradiation if you were battling cancer, HIV, poor diet, sugar, things like that. And we all kind of deal with it. So, Lulu's been on a lot of different medications. She's an older pet, different diets and things like that. And she's just older. So she's going to have some possible, leaky gut syndrome going on here. And because of that, she's got a low intolerance of food. So things are getting through this tract easily, reacting to the immunoglobulin that causes different types of anaphylactic reactions and more prolonged reactions like diarrhea. So getting an idea of what food that she's sensitive to can help start to reduce her chances of having a reaction to it. So, like, if she's been consistently fed certain proteins, so and things like that. So, and just to get an idea is a good way to start a romance. That's why I usually start people on that, because the trick can be that if you don't do that, then you're going to be, no matter what type of supplement you're using to help with diarrhea, it's not going to help if she's continuously getting a reaction to the food she's eating. So yes. So that's sort of where I'd recommend to go. And then also, she's doing an animal biome test, which is good too to see uh, what her gut looks like as well. So yes. So Laura is doing really great with Lulu, and so you have to keep us posted on everything, Laura. Um, and so yes, and that was my other thing that I was going to talk about, leaky gut. So I would normally start a client on. I would do the Glacier Peaks test to get an allergy panel to see what allergic reactions there are to certain foods. And then I would start a broad spectrum probiotic to start getting good bacteria in the gut. And then possibly another supplement to help strengthen the lining in the gut. There's supplements that do that. And I'd start with that and then possibly move over to fish oil at some point as long as there's no reaction, and then slowly diet change. So, and I've had good responses with that. I've had a client that got a really good response with Phytospore with a dog that had constant diarrhea and is now getting solid stools. And she's very nervous about getting to a new diet. So it's been 6 months. And so I think she's thinking about starting, she's so afraid to change the food, which is understandable. And I've had another dog that I got on all this kind of stuff, and he didn't have very light food sensitivities or very strong food sensitivities, I should say, but more of scratching and itching, and that's gone down. So we're trying to slowly take him off of medication. And then I have another client that went full force, did the probiotic, fish oil, diet change, and was getting cytopoint injections every month for itching and hasn't had one since the diet change. So gut health is going well. And her pet is now less reactive to outside allergens. So yeah, so I've seen definite results in that. And plus, a long time bringing up Sun Dog Cat Moon and seeing results from that. So yeah, so that's something I thought I'd talk about with y'all. Since we didn't have too many questions, any of that made sense. I know a lot of you know about it already because you're already fitting the diet, which is amazing. So I'm probably preaching to the choir here, but let's see. I think that is it. Yeah. All right, y'all. Well, have a good week. Y'all are amazing owners. You're doing amazing things for your pets. Laura, keep us posted. Lulu is so lucky to have you. And yes, that is it. All right, let me go check here on the chat. All right. I think I messed up that whole thing with the window. Sorry about that, guys. All right. All right, y'all have a good week, and I will see you next week. Bye.